Hi, my name is Harman. I'm one of the instructor here in Dental 101, and today I will show you how to self-assess your work. So today I'm going to show you how to self-assess your amalgam restoration, and I'm going to assess this restoration which is done on 3/6, and it is done by one of our candidate. So now I will go through all the steps. How to assess this tooth and how to assess amalgam restoration one by one, the stepwise one by one. Okay, so first step for the self-assessment is to check the finish, restoration finish. So for this tooth particular restoration, you can see that there I can't see any porosity over this restoration on the surface of this restoration, also on the lingual surface. So this restoration lies in a very good criteria of the first step, which is restoration finish. And if you can feel any roughness, like just some areas of roughness, then it will go into a satisfactory. But you have to make sure that that the surface of your restoration should not have like any more areas of roughness that required correction. Okay, so that can be achieved by doing good condensation and burnishing, and also you can use cotton to smooth it while doing your carving or condensation. So always concentrate on your condensation and burnishing as well, which is very important to achieve a good restoration finish. And the next step is material handling, which is like if you notice any porosity, for that we will assess. And in this restoration I cannot see any void, like at the junction of the tooth and restoration surface. So how I'm checking this, I'm moving my probe from the tooth surface toward restoration, and if so here I feel a catch. That I feel is due to excess of restoration in this area. So how I can correct it? So I will take my spoon excavator and I will place it in an inverted surface, like my concave part of my spoon excavator will face toward the tooth surface, and then I will keep my spoon excavator on that particular area, and I will move it from tooth surface toward restoration and remove any excess of restoration, so that, and give it a smooth junction, any catch. So if you have any excess restoration, you feel a catch due to excess restoration, you can use your spoon excavator to correct that defect. And now you can see that the catch, there is no catch. So like same over, yeah. So how you can check any void or cleft. So now this restoration is going again in a very good part for material handling, means porosity. So this restoration is free of clefts and voids. The other thing is material handling for any debris. So now we will check for any debris. If there is any amalgam debris on the tooth surface or on the amalgam restoration or around the tooth. So here I can see that my tooth surface is free of any debris, but there might be a little bit debris around the tooth which can be on the gums, on the gingiva. So you have to make sure that you have to remove all the debris from the gums or tooth, or even from the restoration itself. So your restoration plus your tooth surface and tooth surrounding should be free of any amalgam debris. Okay, and the other thing, that next thing that we can check is restoration integrity. So you can see that my restoration is intact. There is no fracture, and it is like the whole complete restoration is present in this tooth. So this again is going into very good criteria of this step. Next step is tooth restoration junction. This means your tooth and restoration junction should not be detectable with the help of probe again. So as I will run my probe, and I can see that you can't detect like this. So you can see that my probe is running freely over the tooth restoration junction, so it is not detectable with the help of probe. Means I have smooth tooth restoration junction. So again, this step is going into very good criteria of the restoration. And if you feel any detectable or any junction which is detectable probe, you can either, if it is because of the excess of the amalgam, you can fix it with the help of spoon excavator. Otherwise, if there is any void, then it depends how big the void is. So according to that, it will, if it is like more than 0.5 mm, definitely it will go into unsatisfactory. But if it is less than 0.5, then it will go up to borderline. So you have to make sure that for this purpose, condensation and burnishing is very important step. So always concentrate on your condensation and burnishing while packing your amalgam restoration. Okay, so this will give you a good finish, good and restoration free of cleft and voids, and also it will provide a any good junction, smooth junction that will not be detected with the help of probe, like junction free of clefts and voids. Then we will check for overhangs, so which is in the proximal area. So here you can see that there is no overhang around the near the cervical of the tooth. So if you feel any overhang around this area, you can use wheel and carver. This is the wheel and carver, so you can use this instrument and you can reduce that overhang with the help of this, or you can use your soft flex strips as well, but use it very carefully, so do not reduce your contact area. So always use it very carefully, and just I think this wheel and carver is more helpful, more useful to reduce these overhangs from the restoration. Okay, so according to this restoration, this is again going very good criteria for overhang, as I cannot see any cervical overhang in this restoration. Next is damage to adjacent or assessment tooth. In this, because it is like the least possibilities in restoration, but still we have to check. So you should not damage your adjacent teeth plus your working tooth. So always while doing carving, you should make sure that you should not damage your tooth, or also while placing your band around the tooth, make sure you should not damage your gingiva. So which, if you damaged it, then it will go into satisfactory to unsatisfactory. Okay, so the next two criteria we have to check for any damage to gums or teeth. Then the next thing is proximal contact tightness. So you can see in this restoration, my mesial contact is good, like with the adequate optimal contact tightness. So this is not a loose or slight contact or not a tight contact. How we can check for a tight contact? I will pass this floss through this contact, and you can see it's going with the soft tug. So which means that it is an optimal contact. So my floss is that contact is not provide any resistance to my floss, and it also not like passing freely inside that area. So which means that this contact is an optimal contact. But you can see that distal contact, so distal contact is not like, is an open contact. So you can see it with the with the naked eye that contact is open. So definitely this contact is going into unsatisfactory criteria, so which is not acceptable by ADC. So always you have to make sure that your contacts should be optimal and close. Okay, and if you feel, if you get this type of condition in your exam, how you can fix it? So you can just remove this part of your amalgam and create a box, and then again adapt your Toffel-Mayer band, or you can use V3 matrix band to make a contact, and then again fill amalgam in this, pack amalgam in this area, and then pack it, and then you can do a carving this area, and then you can check for the contacts then. So this is the way how you can correct your contact if you can get any open contact. And if your contacts are too tight, for that you can use Softflex strips, but always try to use the fine part of the Softflex strip, so that you should not But now you can see that the distal contact of this restoration is not optimal, as it is an open contact. So yeah, you can see this is an open contact. So which means that it is going in an unsatisfactory criteria of the amalgam. So due to which you can even fail the task as well. Instead of doing all other criteria good in all other criteria, if your contacts are open, that will take you in a fail grade. So always make sure that your contacts should be closed, and not should be too tight, but should be closed optimally. So how, if this condition occurs, if you can get this condition in your exam, how you can fix this condition? So for this, the only thing in amalgam is that you have to remove the amalgam. So definitely it's not, because you get a good contact on the other side and overall your amalgam is good. So instead of removing the whole amalgam, you can only remove that part of the amalgam, and you can make a box on that area, and then you can adapt your band, Toffel-Mayer band. You can use your Toffel-Mayer band, or you can, in this condition, you can use your V3 matrix band, which will provide a good contact area, because they have a natural bulge in their bands. So you can use that bands also, that V3 matrix bands as well. So now you have to adapt to your band here, and then you can pack again amalgam and condense it properly, nicely, and burnish it, and then you can carve it. And after that you can check your contact areas, that now are you able to achieve your contact areas or not. And by doing this, you can save time, like you don't have to remove your whole amalgam, but that part. So by doing this, definitely that will not take you in a very good state, because sometimes that the shade differences, or examiner can check. But always make sure that while packing another amalgam capsule, your finish, there should be no catch in between two amalgam restoration. That will not differentiate your restoration. So always make sure that they have a smooth junction, and that's all. So otherwise that will save your time, and also you can get a good contact and save you from failing this task. Now we are moving to next criteria, which is proximal contact contour. So in this restoration, these are good proximal contours, means you are not seeing any overhang or any bulge in the proximal area, so which means they have good contours. So you can also check your contour with, and you can match it with the adjacent teeth contours, or the other, on the other side you can check it like how your contours are appearing on your natural tooth. So you need to maintain the same contour on your restoration as well. And then is the occlusal anatomy. So, and as you can see in this tooth, the occlusal anatomy is good and in more detail. So what we need to check in occlusal anatomy, mainly we have to check the position of our central groove and fossas. So how we can check it? You can use your probe and you can keep it. So with the this premolar, you can see that your central groove is matching with your premolar, and from the other side you can see that this is. So overall your central groove is passing through the center of the tooth. And to check the thing, we need to check the position of our cusp, that you can match with your tooth on the other side as well, so that you can see that the position is usually a little bit distal from the this cusp on the buccal cusp, and or you can match it with the tooth on the other side of the arch, means with the 4-6, if it is intact you can match it with that. So in this tooth I can see that the position of the cusp is adequate, like it's at normal position, and overall anatomy is good. And then is the lingual or buccal tooth contours, which, so in this tooth we are talking about the lingual contour. So you can see like this. So contour is adequate, so it should not be flat, it should not be over contoured, like it should not go out from the, if you can see from this line, it should not go, like it should not be very bulky. So if it is bulky, you should to reduce it, and always make sure while reducing you should not over reduce it. So don't make it flat, or like don't give any taper to this area. So it should have a good round contours. And then is the cusp height. For cusp height we have to check with the adjacent height. You can see, so always like the height of the mesiodistal cusp is a little bit like less than 0.5 mm or 0.5 mm lower than the mesial cusp. So you can see that this cusp, the height of this cusp is a little bit lower than the mesial cusp. Are you right? So how we can check the height of cusp? Then is the cusp position. So we already talked about cusp position. So if you can check from the occlusal surface, you can see that it is in the little bit, if you can check from this side, like if it is going like this, maybe a little bit inside, but otherwise it is functionally it is position is okay. So it will go into a satisfactory criteria of the amalgam restoration. So, and then is the marginal ridge height, which is very important. So always make sure that your marginal ridge height should be equal to your adjacent tooth. So in this restoration, you can see that the height of mesial ridge is above from the adjacent premolar. So you can see that it is high. So if it is high, you have to reduce this ridge height. So it should not be high or low from the adjacent tooth, but so it should be like this. You can see that the distal height is almost at the same level of the adjacent tooth. So it should be like this. This is the optimal height of the marginal ridge, so which we need and it is going into very good criteria, but this is not going good. So it is like how much you can check it. So it is almost like 1 mm higher than the adjacent tooth, so it is going in unsatisfactory criteria. So always maintain your marginal ridge height. All good.